Hi, Catherine. How did you find the big conversation today?
I found the big conversation today just illuminating because it was a really good time to pause from our general busyness to really focus on the Mental Health Act. And what does it mean for people? I think when we hear about legislation, we only think about what are the punitive things, the rules and the regulations we have to follow. And I think today's conversation made us pause to really reflect in a deep way. What does that mean for people? What does it mean for their recovery? What does it mean for people to enhance and be able to give an opportunity to embrace all of their human rights? To be able to give them the opportunity to recover on their terms, to remain connected to their community, their culture, have lives of meaning, of hope, of empowerment. And so for me, it was a big conversation about issues, and people were at the heart of it, actually not the legislation. The legislation should be there to support people when they need specialist care. But let's think about that also. What else can provide specialist care and support? And I think that for me was the beginning of a conversation that we're going to have in the future. And that will be, how can we use our services in the best way to support people to recover in the way that they want? And the way to do that is to listen and engage and have people with lived experience leading that conversation. So when we go forward and we look at the Mental Health Act and what ways we may need to amend it, review it, the voice of lived experience has to be at the forefront. And we need to understand that the Act will only ever be optimal when it meets the needs of people, when we have a system of care across New South Wales that will support them to reach their goals, and that we have a legislative framework that absolutely knits in to support them, then we're going to be on a really good road to recovery of our mental health services, of our community, to improve the mental health and wellbeing of all.